Beep, 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 beep. It's a heartbeat. Another one just went by. Oh, there goes another one. As many times as you try to save someone's life, it is hard to try to save yourself. But what can you do to help save someone else's lives when you're also saving yourself? Donating a heart or giving a heart transplant is one way you can do that. Now, since 2010, there has been over 100,000 heart transplants recorded, but only 60 of those, roughly 6,000, medically speaking, are able to have a heart transplant. Dr. Franklin from Harvard University states, "Today we live in such a strange world, today we live in such a hard world, that no matter what we face with, it can be a difficult choice when to make between life or death." Now, relating to hearts, a lot of people do have failed hearts. A lot of people don't know how to save their own life, save their own heart. But what they can do is try to help recover from it. Now, obesity is the leading cause in deaths in America. It's actually heart disease, but obesity can be a cause of that factor. Now, with heart disease and with heart failure comes the people that need to be able to support them, such as you and me, such as the kid next door, such as your friends, your family, or the kid on the street that you've never even seen, but he has a heart. Anyone who has a heart can easily save someone's life. Now, donating today, donating in the future, donating in the past, donating whenever can help save someone's life in the future that you don't even know who exists. Heart transplants are so hard to come by that it's such a difficult process, because removing the aorta valve, removing the right arterial structure of the heart can become a difficult process, because it has to be hooked up to a lung/heart machine which circulates the blood and keeps it flowing so that the heart doesn't collapse while the surgeons are taking out the heart and replacing it with a new healthy one. Now, for recovery of this lasts about 2 weeks in the hospital plus about 2 more months of just rehab and cardio strength. Now, after this, roughly, if you're over the age of 60, you about have 10, 15 more years to live. It depends how well you keep up with your heart exercises. If you keep on doing cardio, if you keep on doing strength, conditioning, eating healthy especially is very helpful, because all that fat balance that's around it can decrease that heart sufficiency and can make it be constricted. Now, with the process of giving heart surgery is finding a heart. What or how can someone usually find a heart? Now, hearts are only harvested about 4 hours after death. So when someone dies, either it's intentionally or if it's an accident passively, that heart, if they donated one, if they registered, can be used within 4 hours. Now, after that time, it is dead. It's a dead host. All the cells, the mitochondria, and the tissue start to deteriorate. Now, I don't know why it's 4 hours, but only God knows. But because of that, the things that you do, the things that you do for this heart that you have, can help save someone else's life. Now, today they have tons of electronic hearts that are trying to be in place. They have stem cell research. They're trying to use monkeys. They're trying to use pigs, chimpanzees. Trying to use all these different animals to be put inside of us to help save someone else's lives, when us ourselves are becoming selfish and not saving somebody else but our own. Now, with today's world, Dr. Kaiser, when he previously stated that death is such a factor in today's world that it's hard to come by, that life is. So in researching from Cornell University, they stated about how the heart can officiate how a person's actions are going to take place. How are they going to live their normal life? They're going to live a life healthy? Are they going to live life relatively? They're going to live life prosperity? How are they going to live their life? Because no matter how they're going to live it, it just depends on how they're going to take care of it. Now, with heart transplants, those can be a pain in the butt. I have personally seen a heart transplant taking place on the surgery table, and the amount of stress that it can take on a surgeon, the amount of stress it can take on the family or a patient is very excruciating. You have life in one hand and you have death in the other. If a surgeon is not highly qualified, if he's not comfortable with the job, the surgeon can go haywire and go downhill. But in the end, even anyone can donate it. Speaking from a little kid's perspective, it just has to have a parent consent, and to where usually it's around 16 years old. Even a little kid can sign up, a teenager, 12-year-old. Anyone can really donate a heart besides a baby or a little infant. because of how small it is and how the capacity it grows over time. But they always say the younger the heart, the better. But it doesn't mean you can live longer. It just matters how much you take care of it. Heart transplants are hard. Heart transplants are not easy. But what differentiates between a heart transplant, what happens in it, is always in the outcome of the provider, of the surgeon for it. And with everything that has done in the past, from the doctors, from the first heart transplant in 1969 to today, where we're using electronics and we're using pigs and we're using monkeys to try to replace our own self-esteem, our own selfishness, desires for somebody else's life. Now, signing up today can be able to help save a life tomorrow. Now, I'm not saying you may die today, you might die tomorrow. What I'm saying is that if you start something, somebody else may even start it more. So sign up today and be a part of the heart transplant trend, because hearts are hard to come by. And when a heartbeat beats away, beep, and that steady steam glows, there's another one that has passed.